Okay, so building on the background that the cases that we receive from the communities are just a small fraction of the cases that are generally happening and of the factors that are also contributing to the occurrence of these few cases that we see. The thing is that in the communities, there are many things that are happening that are contributing to these few cases that we are seeing. There are many of these cases that we have not diagnosed. Okay, there are also many of these cases that people are having and they're not aware that they are having, and they are continuing to participate in activities or in habits that actually put them at a bigger risk. So in here, we want to look at these determinants. Okay, so when we talk about determinants of health, what do we mean? The definition is not often very easy. They have very many definitions if we talk about determinants of health. The simplest definition is that these are factors or conditions of where people live, work, and even age. These factors influence health. Okay, so the simplest way to put it is that determinants of health are conditions of where people are born, where they live, where they grow, where they work, and where they age. These conditions, whether they are economic, political, environmental, or social, these conditions influence people's lives. Okay? So we can call them plainly as determinants of health, or we can say social determinants of health. Okay? We are saying that they are non-medical factors that contribute to health outcomes. And remember, when we talk about health outcomes, we are talking about, in general terms, we often refer to the state of health. Okay? The state of health can be good or bad. So what are those factors that influence the state of health or health status? That is what we term as health outcomes. So where you are born determines whether you will live long or you will die young. The child who is born in North America has more chances of surviving compared to a child who is born in sub-Saharan Africa. Okay? That's what we mean by health outcomes. That even where you are born, before you commit any sin, your chances of life are very few. That's what it means. So before we go deeper into these factors, we need to get some definitions out of the way such that when we use them later, you don't get confused. So the first term is health inequality. The truth of the matter is that you will not have people having the same status of health. It's never possible. It's never possible. Even if they are twins, they may not have the same level of health. So that is an issue of health inequality, that they are never equal. The problem comes in when that difference in health status is because of unjust reasons. Unjust reasons. So, for example, if I am supporting a political party X, then I go to the hospital and then they don't treat me because I support a political party X, and then I die, that is an issue to do with health inequity. Okay? That I have died not because there are no health facilities, but have died because there is unfair decision that has been made that I should not be given health facility, health care. So there's a difference between health inequality and the health inequity. So with the inequity, it is unjust, unfair, and it is preventable. Okay? And then the word health disparities can be used interchangeably with the health inequity. Okay? So that. I think that definition is quite okay. Health inequality emphasizes that however much you try to give people the same level of care, whatever it is, there will always be measurable difference in health status. It only becomes a problem when that difference is because some decisions are unfair. When every state is supposed to have a state hospital, and then in one state there is no state hospital, that is unjust. When every hospital is supposed to have a surgeon and an anesthesiologist, and then one hospital does not have those because someone decided no, they should not receive a surgeon, they should not receive the anesthesiologist. So those are unjust decisions, and they result into health inequity. And then the other term that we also need to clear out of the way is the social justice. That we have some communities that are not accessing healthcare services or generally services, okay, because of inequitable distribution of resources, opportunities, and privileges within a society. So these are people who are not having equal access to, whether it is education, whether it is healthcare, whether it is job opportunities, whether it is legal representation. Basically, they are left to be on their own. When they are distributing the cake, they are left out. That is social injustice. So social justice is when we are saying that we have resources, we have opportunities, we have privileges. How do we share them? If you share them fairly, in a just manner, then you are achieving social justice. Okay, so we go back to our discussion of the determinants of health. The things that influence health can be biological, behavioral, environmental, or even social. But in our discussion, we are going to emphasize that they can be political, they can be economic, they can be health system factors, they can be cultural factors. So this is a small breakdown of these factors. Okay, behavioral, biological, environmental, and social. Where does this concept of social determinants of health emerge from? So WHO commissioned a study, and that study released the report, and that report was called Closing the Gaps in a Generation: Health Equity Through Action on Social Determinants of Health. That commission was led by Sir Michael Marmot. If we are talking about social determinants of health, there is no way you can leave this report out. It is one of the landmark reports on social determinants of health, and it emphasized issues to do with health inequality, which health inequity, which we have defined quite well, social determinants of health, policy recommendations, and global perspectives on how to look at health and social determinants of health. Okay, so at least don't never forget that that report. So these factors are quite many, and we have said that they can be in different categories: political, economic, social, psychological, everything. And there are different ways of tackling them. I mean, looking at them one by one. And this is one of them, looking at the broader societal factors, the socioeconomic factors, health behaviors, biomedical factors, individual factors, psychological factors, safety factors, many things. At least before we close this discussion, we need to get this out of the way again. Look at if you are a rescuer, you are rescuing people who are drowning in the river. You can deal with that problem in two ways. You either be stationed in a way that you can pull everyone who is drowning, or you can go and understand why people are drowning and then deal with that problem before a drowning happens. So that is an issue to do with upstream and downstream determinants of health. So when you are dealing with the people who are already drowning and you're pulling them out of the water, that is downstream. You are handling the problem when it has happened. Okay? If you go and prevent people from drowning, falling into the river, that is upstream. It also helps in solving a problem. So what you are saying is that when you're dealing with these determinants of health, you may need to think whether they are upstream factors or downstream factors. Downstream factors are those that focus on individual level factors. The person is already drowning, I need to deal with that person. The person is already having diabetes, is already having hypertension, so you deal with that. That is basically clinical care. And then upstream, for which it is broad, what are the things making the people to drown? Or what are the things making the people to get sick? So is it social, economic, environmental, behavior? Then you deal with that. So usually in public health, you deal with upstream and downstream factors. So you can have what you call upstream interventions and downstream interventions. I hope you have got that very well. The other thing, this is the second model that we are looking at in this presentation. The first one was the iceberg model. The second one is the ecological model of health. This, again, explains the fact that you have different factors that contribute to diseases. And these factors can be looked at individual level, at interpersonal level, at community level, at societal level. Okay? And for each of these levels, you have different factors in between there. So that means that you can do more reading on this model. Okay? So in all these other factors that you can look at are basically determinants of health. We have emphasized that the diseases that happen in a population are as a result of multiple factors. These factors can be political, cultural, social, economic, health system, whatever it is. And the landmark report on the social determinants of health by Sir Michael Mammoth is one of those key determining documents that has led public health professionals to focus on looking at the contributors to poor health in order to address issues to do with health inequities. So time for questions.